So today I just want to start off by recognizing all the veterans. Thank you for your service. Today's a big day for everyone that has served and continues to serve. And just to remind the American people, we've been at war for over 19 years. And just to give you a little history lesson, 1.3 million Americans serve in the United States military as of today. And if you look at our population of 328 million Americans, that's less than 0.04% don that uniform for our freedoms that give us the right to believe in whoever we want to believe in, to agree to disagree, but to do it peacefully, and to have these protests around the United States and to vote for who we want to vote for. So thank you to all the veterans that are out there. It's not possible without you to have this foundation in this great country that we have. You know, I just want to say this one quote, and it kind of fits what's going on with the COVID-19. Success is not based on how well you do while at the top, but how you bounce back when you hit the bottom. And we sure as hell are at the bottom, and it's only getting worse. So today marks 245 days. We're 35 weeks since Albany County's first COVID-19 test back on March 12th. There are now 4,114 positive cases of the coronavirus, 1,492 people under mandatory quarantine. So we have a net increase, and I thought 68 was bad. Today is the highest we've ever had since this began for us, 99 positive cases as of today, overnight. So I did not think Dr. Whalen and I would be back here again after the last couple of days in the high 60s, but I can assure you last night our phones were going crazy and we're going back and forth with all the data, not believing we hit 99. And I remember having the conversation with Mary last night, and I go, I don't think we've ever hit 99. And, we didn't. We never have. We never had this many cases since April 30th. We had 94 on April 30th, just to let people think of it that way. We've never had this many people under mandatory quarantine. The closest was May 5th with 1,107. So this is the most amount of people we've had on quarantine since this has begun. On October 10th, we hit 1,000 cases again, and we went down a little bit. We dropped to 800, and ever since that, we're steadily going up in the wrong direction. Of all the new positive cases today, we know 41 had close contact of positive cases. 13 are healthcare workers, and 3 people had reported traveling out of state. 42 people don't have a clear source of infection. I just, was reading an article on the New Jersey Health Commissioner, and it kind of fit into what Dr. Whalen and I were saying yesterday. 60% of the people lie when it comes to tracing. You can't combat this. You can't stop the clusters, and I know it's a question everyone has. Why can't you pinpoint it? When people lie to us, we can't. So we need you to continue to do the right thing like everyone's doing, wearing their mask, coughing into their arm, cleaning their hands, and staying 6 feet apart. But if you lie to the health department when they call you and they're trying to do their job, we're never going to be able to stop the spread or pinpoint why it's getting so big like it is. Yes, I am worried. That's why I'm here on Veterans Day. 99 overnight, and thank God no one passed away. So please help us help you. And it's just not here in Albany County, in New York State, it's in New Jersey, it's all over. People feel like they're helping their friends out by not telling them. 14 days in your house is not going to kill you. Do you want to go back to 4 months of being shut down, no one being allowed out? Then help us. So we have 18,233 people that have now completed quarantine, 3,698 tested positive for the virus, a recovery of 49 people. We have 35 people currently in the hospital that are hospitalized. The hospitalization rate is 0.85. Yesterday it was at 0.89, so that went down a little bit, which is good. But I think everyone heard what Dr. McCann was saying, about the hospitalization staying their capacity. And if there's any questions, I will let Dr. Whalen handle that one. Again, The last time we had this many people in the hospital was April 20th, and we continue to see the hospitalizations, people hospitalized in their 30s is up to 43 people through early May. So from 30 to 43. So if you look at that, again, we're steadily climbing in that, which is alarming, and we have to be ready for. 5 patients are currently in the ICU. Yesterday, that number was at 5. It stays the same. Over the last 5 days, the average of 66 new positive cases each day. It was 55 yesterday. Our 5-day average of new positive cases has also never been this high. Our numbers continue to go up in every category. Yes, we're testing more people, so our numbers are going to continue to be higher than when we first started. But this isn't the whole story. We have the micro cluster guidelines sent by the state, and we don't, I don't want to get into it at this point. It's complicated, but it gets into the red zone, the orange zone, and I believe the green zone. No, I'm saying that wrong. So it's the red zone, the orange zone, and the yellow zone. And it breaks it up how they're going to do it going forward. And it's a question we get on Facebook all the time. And it's one of the things. Yes, testing. We're going in the wrong direction, people. So this is the highest. It's not because I don't want to pinpoint on one way or another, but we have to be cautious. I do want to address a question that was brought up yesterday about the real estate reality show. We got that down a little bit. We continue to contract trace there, but we have 3 known cases associated with it in Albany County and 2 additional in Rensselaer County. So again, we need everyone to continue to take this serious. Everyone needs to do their part to get through this. I know I sound like a broken record when I keep saying, please wear your mask, cough into your arm, clean your hands, 6 feet apart. And I'm worried with Thanksgiving around the corner. I am extremely worried. People want to try to socially distance and do the right thing. I get it. And I'm going to say this to my family too. It's time to take a pause, take a step back, do it via Zoom. There's always next year. And when we get out of this, there's no reason why you can't celebrate Thanksgiving 4, 5, 6 months from now. Or do it twice next year when we can get together or have a nice celebration when we get the vaccine out to people and we're not in this situation that we're in. There are plenty of places to go to get tested. We continue to say that. I don't want people to worry about it. If you can't pay for it, Albany County will pay for it. You can go to UAlbany. It's free to go through UAlbany. I continue to put that number out there. The schedule appointment at UAlbany, 1-888-364-3065. Our Whitney Young, great partnership we've had with them since the beginning, setting up the mobile testing sites through downtown Albany, and continue to be out throughout the community, 518-465-4771. And as always, CVS, Walgreens, Rite Aid, Albany Med Urgent Care, Priority One, Central Med Urgent Care. Full list. Go to albanycounty.com. There's no excuse why you can't go out and get tested. If you're at one of these clusters or you feel you have anything going on with you, please get tested. And especially parents would have kids in schools. If they have a temperature or anything, go get tested. It's it's this easy to spread it. If you travel somewhere or you went to, say, an area of the state that's a hot spot, and you come back, and now in the new travel standards, you have 4 days to get tested. So if you get tested in them 4 days and you come back negative, you can go out, right? But if you don't get tested and say you go out in them 4 days, you could easily spread. If you go to the grocery store, out shopping, or wherever, you could easily contact 40 to 100 people and pass it that quick within them 4 days before you even know you have it. And most people, 40%, I think, and I'll leave this to Dr. Whalen, I think it's like 40% of people don't have any signs or symptoms. They feel no symptoms. So, you have to think about it that way. So even if you feel healthy and you're exposed to somebody, get checked. It's too easy, it's too convenient, and you're going to help us get through this. Again, please help us do our job. I'm begging you, help us do our job so we can stop this and we can get back to some type of normalcy. It's not going to change if you don't help us. Dr. Whalen.
Thanks, County Executive McCoy. So certainly our numbers are concerning, and as we indicated yesterday, we are seeing a disturbing rise in the number of cases. The amount of testing that we're currently doing cannot explain this alone. It is obvious from our investigations and from our numbers that this indicates that there is likely a bigger risk in the community and that there is community spread. So from that reason, it is necessary, again, for everyone to continue to protect themselves. Early on in the course of this, we discussed acting as if you have COVID and you're trying to protect everyone else from getting it, and that guidance is still something that we would recommend. We had additional information yesterday from the CDC on masks, indicating that at this point we can now say that masks not only protect others that you're in contact with, but also protect you. We've known that these type of masks can certainly prevent droplet type infection, and now we're seeing evidence that it is suppressing rates of COVID. So masks are still essential, but it is more than just masks. It is more than just washing your hands. It is about keeping physical distance and really limiting the amount of interaction you have with others, especially large groups and large group settings, as we know that these are situations where people put themselves at risk. For schools, as the county executive indicated, it's very important that parents get their kids tested. Kids can have minimal symptoms. We do encourage children to be tested. We encourage everyone to be tested that has concerns around either symptoms, even if they're mild, and exposure. And when we talk about testing, again, this is a message I discussed last week, but I want to make sure that everybody's on a clear page about what type of testing you should get and what those test results mean. So there are basically, if you put them into very broad categories, there are rapid tests and there are laboratory-based tests. Rapid tests include antigen-based tests, and they also include molecular tests like Abbott ID Now machines. Those results are available in about 15 minutes, and people like them, of course, because of their convenience. These rapid tests you can accept a result of a rapid test if you are asymptomatic and you're looking for screening. If, however, you have symptoms and you want to rule out COVID-19, a rapid test is not enough, according to the guidelines that we're getting from the State Health Department. In a situation where an individual is symptomatic, you need a PCR laboratory-based test. So these are the tests that are sent off to the lab. You do not get them immediately, and they may take a day or two to come back. We urge everyone, while they're waiting for those tests, to remain at home in isolation. And in fact, that is good advice for anyone who has symptoms of COVID-19. Even if your symptoms feel like a cold, stay at home until you know what's going on. Those tests, the PCR tests, are really the foundation of diagnosis. We are requesting confirmatory tests on symptomatic children before they are allowed back into school. And for those of you from the public that are getting tested, it's important to know that the PCR is the important test to get if you have symptoms. If you have persistent symptoms, even after a negative PCR, if 2 or 3 days later you're still having fever, cough, shortness of breath, you should get retested. As I said, and as we've said since day one, this is a dynamic situation. We're learning about testing, about methodology, about accuracy as we go forward. And currently these are guidelines for New York State Department of Health in terms of the PCR testing. And anecdotally, we are seeing a small amount of people, and I don't know whether this will become evidence and guidance, so I want to just say this is something that we have observed, that we have heard of a lot of cases where people have initially tested negative and then go on to test positive. So if you have persistent symptoms, do test again. And again, that is just something that we are observing. It is not formal guidance. It is something that I would like to make the public aware of. COVID-19 is a smart virus. It's a tricky virus, and I understand the frustration of the public with the caveats that we have to give around testing. But this just shows you the risk, and I think that this is a further reason to double down on protective behaviors. We need to really, in the next 6 weeks, until we start to be able to get more information about vaccine availability, we really all need to consider limiting our movements as much as possible. I'm concerned that in the coming days and weeks we are going to continue to see a rise of cases, and this is the best behavior that we can tell you to do to prevent you and your family from being infected. For individuals who have mild infections, please remember that a lot of young people in particular have mild infections. It would be an illness, the clinical symptoms of which would normally not keep people at home. Stay home anyways. Stay home to save a life, because your actions and what you do, others' lives could be dependent upon it. Act as such. For those of you that get a contact from the health department and are advised to quarantine, in this situation you have no symptoms. Again, isolation is the restriction of movement of those that are ill. Quarantine is the restriction of movement of those that have been exposed and are asymptomatic. So for you, you probably feel completely fine. And a lot of people are saying, but I feel fine, why should I have to stay home? And again, the message is, you are staying home for an incubation period, which is 14 days. We know that after exposure, it can take up to 14 days to become ill. Then the question is, well, why can't I just wait till I feel sick? And the answer to that is, because you can transmit 2 days before you become symptomatic. So for 2 days before you develop symptoms, you can walk around and put others at risk. This is a message that we have, again, tried to make clear from the beginning. But as with so many things, people don't take the message in until it directly pertains to them. So please know about the importance of quarantine. And for this reason, the message that the county executive continues to discuss about being truthful, about being forthcoming with information on your contacts is essential to limiting spread. If that information is not provided to us, we cannot do our work. We cannot prevent this from spreading in the public. If you do not adhere to quarantine or isolation recommendations, again, we cannot be at your home every day. We cannot park a police car outside of your house to make sure you don't go out. This is individual responsibility. This is civic responsibility. And on a day where we remember and honor so many that have done so much for our country, I think it's important to remember these are not big sacrifices. These are short periods of time, and they can make a big difference. So please do your duty, do what you are asked to do, be forthcoming with information, and help us to help the community. Thanks.
Thank you, Dr. Whalen, as always. And, it's 8 months, and I get it. Everyone's tired, and I've said this before. None of us thought we'd still be here. If you asked us that question 8 months ago, the answer would have been no. And we'll get through it. We'll get through it working together in a partnership, being resilient, and we can do it. I know Albany County can do it, and we need to continue to go forward. Again, I do want to say thank you to our service members that are overseas serving right now. I just want to give a little shout out to Joe Kuzno, my buddy that's coming home shortly. But thank you, Joe, for your service, and everyone else in the New York Army National Guard. But I also want to share with you the mental health. It's important. People are stressed, and you can see it on their faces, and you can see people are having a hard time dealing with everything. So please, like I said yesterday, reach out to a friend. Reach out to an old friend. How many times do you say to somebody you haven't seen in a year, I don't even know how we stopped talking. You even forget why you were mad at each other. But take that opportunity and that step back and check on that person. Do a buddy check. We do that in the military all the time. We text one another just to see how everyone's doing and getting through this. And I get it from military friends that I haven't talked to in 8 months, 7 months, 3 years. I'll get a text and they'll say, hey, how you hanging in there? Do that. Check on your neighbor. You know better than anyone else, if you live in an apartment complex or on the street, if there's senior citizens there that don't have family or people checking on them. Just go say hello. Knock on their window. See if they need anything. Cheer them up for the day. Put a big smile on their face, and we'll get all through this. But the mental health hotline is available 7 days a week from 8 a.m. to 5 p.m. 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. The United Way number as always, and the New York State hotline number as always. And please continue to do the right thing.